In class a couple semesters ago, I had the opportunity of taking a class on death and loss and complex family issues, and we actually studied about death. And I know it's just a morbid subject, but I thought that the impact would be great. To start it off, we're going to talk about a lot of great things today. We're going to have food demonstrations, so many wonderful things. But I thought the impact, I was telling someone, and I won't read necessarily the notes, but I recall in the class, and it was saying that many times, you know, our father figure, typically what we have him to do is, he's primarily our breadwinner, oftentimes in the home. But when a mother dies, how it impacts it and alters the trajectory, the whole pattern, the paradigm of the family, you know, because she's that person who's been there nurturing, doing all those great things. And so it just changes a loss in the home for a mother. It impacts the family entirely different than the loss of a father in the home. And I know many of us will question that, but it is absolutely true according to our statistics. The death in the family involves multiple losses. The loss of a person, the loss of roles and relationships, the loss of the intact family unit, and the loss of hopes and dreams for all that might have been. And you can think about it, and you, like myself, many of you would say, God, you wonder what their plans and expectations were. Or they're not there to be able to be there for my prom, or the day I'm going to get married or have my first baby. And so we think that if we would use whatever measures to let women know that, did you remember those statistics where it said the information simply stated that women will call 911 for anyone else, but they won't call 911 for themselves? I think that impacted me more than anything else to think that is absolutely the case. So without further ado, I'd like to continue with the program, and then we're going to start with Kathy. Kathy actually is a director for Duke Women's Medicine Health and Advocacy Initiative. And when we started talking about doing a Go Red project, someone said, you've got to have Kathy if you're going to do this project. And so we wanted to make sure that we not only talk with Kathy today, that we'll have an opportunity with the Women's Initiative to do other projects as well. And so I'd like to welcome you, Kathy, ask you to come up.
Happy Heart Month, everybody. I'm really excited to be here, and I'm really thrilled that North Carolina has decided to take this initiative on. I know that there have been a number of stakeholders working on heart disease in women for many years. I've actually only been in North Carolina 2 years, and the Women's Advocacy organization that I have worked for a long time is called Women Heart out of Washington, D.C. I also am on the board of the American Heart Association. It's been a personal passion of mine for over a decade. How many of us truly pay attention to our bodies, our emotions, and our health? And like many of you at the age of 41, I never thought about my own mortality, let alone question my invincibility. But when I started having shortness of breath, fatigue, pain in my upper left back, and occasional pain down my left arm while I was bike riding, swimming, or running, I sensed that something was changing with my body. I'd had these symptoms off and on for an 8-month period, but I didn't really pay attention to them or tell anybody about it. I'd heard that things kind of go downhill when you turn 40 anyway. And like many women my age, I attributed it to all the stress that was going on in my life. The year before these symptoms began, I had moved from Baltimore to Memphis, helped my 3 sons to adjust to the move, closed down my psychotherapy practice, and my mom, who was my best friend and lived in the San Francisco Bay Area, died at the age of 61 of a massive heart attack. The day we buried my mother, my grandmother, who lived in St. Louis, got out of bed, broke both her hips and both her wrists. I was traveling all over the country dealing with all of this. Of course, my attention was elsewhere. Thank you. Can you hear me? Wow, that's much better. So my attention was elsewhere. I attributed those symptoms to stress, exhaustion, and grief. I finally went to a cardiologist at the urging of my husband, who's also a doctor. But my husband, like everyone else, didn't think there was any way I could have heart disease. The cardiologist examined me and told me I'd be okay and not to worry, and said I had something like mitral valve prolapse, which is a seemingly benign problem. He really wasn't paying attention either. And then one day, while I was on vacation in the majestic Colorado Rockies in the altitude, I collapsed on a sidewalk with not vague symptoms like I'd been having, but the classic Hollywood heart attack symptoms, front to back chest pain, profuse sweating, nausea. Well, that got my attention. It got my husband's attention too. I went to a second cardiologist to confirm that I had been misdiagnosed. But unfortunately, he really wasn't paying attention either and sent me on my way. It wasn't until I collapsed a second time that I got his attention. Well, the next 8 months, a series of procedures or treatments done to my heart caused complications or failed, which eventually led to my emergency bypass surgery. Believe it or not, even after bypass, I was sick. Instead of having occasional symptoms with exercise, I had chronic, unrelenting chest pain. I was popping nitroglycerin pills like they were candy. My 3 kids were terrified I might die. My husband and father, who are well-connected academic doctors, were frustrated that they couldn't help me. Then I found Women Heart, the National Coalition for Women with Heart Disease and the leading voice for the 44 million women at risk or living with heart disease. I realized something critically important. I realized I wasn't alone. I learned that each year there are thousands of women who are misdiagnosed, have delayed diagnosis and mistreatment for their hearts, and that heart disease among women is more common, is more fatal, and is still less well understood than it is in men. If nothing else today, I want every woman in this room to know that you have the right to early detection, accurate diagnosis, and proper treatment for your hearts. At the urging of Women Heart staff, I finally went to a third cardiologist at a women's heart center where they don't treat women like little men. Women Heart and the third doctor were paying attention. I was put on a medication regimen that worked, and I got my life back. You can well imagine that traumatic, almost 2-year health crisis changed my life and the life of my family and friends forever. My passion about the #1 health threat to American women began in 2002 and has not flickered out. Groups such as Women Heart, the Heart Truth Campaign, and the American Heart Association are paying attention to women and their hearts, and they are making a gigantic difference in this country. I owe my life to people who paid attention, especially my third cardiologist and Women Heart. Their advocacy, support, and education saves lives every day, and there is nothing more fulfilling than being a part of that. As women, we are so busy, as I was, taking care of everyone else and those seemingly critical priorities, holding on to that superwoman thing, that we forget what is most important, the health of our mind and body. And what price do we pay, our family and friends pay, when we put ourselves at the bottom of our own priority lists? How can we possibly ever follow our doctor's advice in managing our risk factors and taking care of our overall health if we don't pay attention to our bodies and what's going on in our lives? So, my wish for you today is that you shift your attention and your priorities by listening to your body, taking care of your emotional health as well, being your best own health advocate, sharing this message with your friends, sisters, mothers, daughters, knowing your risks, protecting your heart, and visiting womenheart.org or AmericanHeartAssociation.org to learn more and join us in our quest. And finally, get as many endorphins, which are neurohormones, which are mood elevators, into your life as you can, into your bloodstream every day by exercising, moving your body in space at a moderate pace at least 5 days a week. You can do that just with simple walking. Having great, intense, passionate sex. Eating delicious, dark chocolate. And laughing that contagious, full-on belly laughter. I'm not a physician, but I prescribe that you get at least one of these 4 activities in your life every day. Doing all 4 is even better. I have no doubt that if you add these prescriptions into your life every day, that your mood and your overall health will improve. Let's all make a pact today that when we will start to pay closer attention. Thank you.